Hi, my name is Colin Gilmartin. I work for Management Sciences for Health on its Health, Economics, and Financing team. Primary healthcare is considered to be a 3-for-1 investment toward universal health coverage, toward better health security, and toward improved health and well-being for the entire population. And as an approach, primary healthcare is considered to be the most inclusive, the most equitable, and the most cost-effective way of achieving universal health coverage. And when countries use those investments to build and maintain a strong primary healthcare system, they're making themselves more resilient against future shocks, future stressors, creating a system that can hopefully detect and prevent future epidemics that are quite costly. And all the while, they're investing in improving the health, well-being, and the health outcomes of their population. So our team at Management Sciences for Health, we recently developed the Primary Healthcare Costing Analysis and Planning Tool, or the PHC-CAP tool for short. And to date, the tool has been used in 6 countries: Eswatini, Ethiopia, India, Kenya, Nigeria, and most recently in Sierra Leone. And in all cases, in all 6 countries, ministries of health and their partners, they're trying to generate the evidence that they need to increase the coverage of and access to what they call a publicly defined benefit package for primary healthcare. And the data that our tool generates is intended to help ministries of health, ministries of finance, and partners improve their decision-making for how they allocate resources for primary healthcare. And the tool answers a number of key questions. So first off, what are countries currently spending on primary healthcare? Second, what should they be spending if, for example, they were to achieve universal coverage of this benefit package? Also, if those services were to be provided to the clinical standards for which they're recommended. And then lastly, what is the estimated funding gap? In other words, what additional resources are needed to ensure universal access and to provide high quality services for primary healthcare? I think costing plays a critical role in increasing access to primary care services. No country by any means has unlimited resources to invest in their health system. So it's absolutely important to understand how much they're currently spending, but how they can spend those resources more efficiently, more effectively to achieve their national health goals and ultimately to improve the health outcomes of their population. Now, in terms of resource allocation, in terms of decision making, costing results have a number of very useful applications. They can be used to inform national health reforms, for example, to inform benefit packages for primary health care. They can be used to address inefficiencies within the health system. We've also seen the use of results being used to inform national and subnational level planning and budgeting for primary health care. Also, we see the use of results for developing investment cases, for generating both domestic and external resources for primary healthcare, as well as for informing provider payment rates and reimbursement. So I think countries are willing and wanting to invest more in developing a robust community health workforce. They really recognize that community health workers, community health volunteers serve as the foundation of a strong primary health care system. And the evidence to guide those investments are quite clear, saying that for every dollar invested in the community health workforce, there's about a 10-to-1 return on that investment. When you consider a healthier, more productive population, when you consider the cost savings to patients and families by bringing services closer to the community, increased employment, as well as, for example, the reduced risk of costly epidemics. So at Management Sciences for Health, we've partnered with a number of ministries of health, as well as development partners such as UNICEF, to really generate those results and develop costed investment cases. And we've done that in Burkina Faso, Madagascar, Malawi, South Sudan, Sierra Leone, among other countries, to really help them generate the evidence they need to successfully implement a robust community health workforce. I I think countries are facing a number of challenges to improve their overall primary healthcare systems. And from my perspective, financing is probably the biggest issue that low and middle income countries are facing. The evidence is quite clear in saying that investments in primary healthcare do pay off. Not only do they help in terms of attaining universal health coverage, improving population health outcomes, but they're also necessary for increasing global health security. And while the evidence for investing in primary healthcare is quite clear, the challenges are many. Low and middle income countries are facing increasing financial tightening. So the question is, how can you do more with existing resources, and how can you do more with less? And that really boils down to spending better. And I think to spend better, countries need access to better, more timely and reliable data to really understand where the resources are going, where services are being or not being provided, where there are inefficiencies in the system that could potentially be addressed to, again, spend better, improve the existing allocation of resources.